So welcome to the information session, COVID-19, Just the Facts. We're here in order to communicate some facts about the COVID-19 vaccine in the hopes of helping HCC become a healthy and safe place for everyone in the community. We are recording this, so as I mentioned, please keep your mute buttons off. Also, if you do not want to be seen, make sure that you also have your video off. This will be distributed, so it will be widely available. Our plan right now is to have it put up on the YouTube channel. We are here to present, as I said, the facts, and our presenter is Mary Jo Sardella, who you can see in your video. Mary Jo is an RN, and she is with the Holyoke Health Center. And she's going to tell you more about the vaccine, facts, myths, data, and really kind of what the whole truth is, and as much as we know right now. Mary Jo, as I mentioned, is an RN. She is the vaccine manager at the Holyoke Health Center, and she has extensive experience in infection control. So now I'm going to just turn this over to Mary Jo and let her move you along. Thanks, Mary Jo.
Thanks, Jean, appreciate it. Hi, good evening, everybody. As Jean said, my name is Mary Jo. I am the vaccine manager at the Holyoke Health Center, and I do have extensive experience in infection control. And I have been a nurse for a very, very long time. So it gives me great pleasure to be here this evening, hopefully helping you all understand some of the facts and myths in regards to the COVID vaccine. The first thing I want to talk about is the vaccine process. It's clearly from the lab to you. That's one of the first steps. The new vaccines, they were first developed in laboratories. Scientists have been working for many years to develop the vaccine against the coronavirus, such as those that cause severe acute respiratory syndrome. I think we've all heard of SARS. That knowledge was gained through past research on coronavirus vaccines that helped speed up the initial development of the current COVID-19 vaccines. No research was overlooked. And then we go from the vaccines, they go through three phases, the clinical trials. For other vaccines routinely used in the United States, 3 phases of clinical trials are performed one at a time. These phases overlap to speed up the process to control the pandemic, but no trial phases were skipped. After further testing, the FDA granted full approval. The vaccine was found to meet the high standards for safety, effectiveness, and manufacturing quality the FDA requires of any approved product.
Mary Jo, I have a question. Could you tell us a little bit more about why this particular virus is a pandemic, and why does that make a difference?
It's a pandemic because it's worldwide. It didn't just hit one country, one city, one area. It's literally hit the entire world. I don't know if anybody remembers the pandemic, the Spanish influenza. It's similar, it's along that guidelines, and it came in very quickly, very fast, and spread very, very quickly. So that's why we consider it a pandemic. It's because it's not just in a controlled area, it's literally all over the world. The vaccine process from the lab to you, its manufacturing distribution. The United States government has invested substantial resources for both the manufacturing and the distribution of the COVID-19 vaccines. Distribution began as soon as the FDA authorized each vaccine. And we know that that was probably about a year ago now that we've actually been having vaccines put in place. So let's talk about who's eligible for the vaccine. Anyone age 5 and up is eligible to get a vaccine. The Pfizer dose has 2 doses, Moderna has 2 doses, Johnson & Johnson has 1 dose. Children's aged 5 to 11 may only get the Pfizer vaccines, but we do have boosters available for adults 18 and older from the Pfizer and the Moderna and the Johnson and Johnson.
Mary Jo, will young children 5 to 11 be able to get the Moderna or the Johnson and Johnson eventually, or?
The Moderna and the Johnson and Johnson are actively working to make sure that that's going to happen. I know Moderna is fairly close. I would say Moderna probably within the next couple of months, if not sooner, we're probably going to have a vaccine for that age group. Yes, Johnson and Johnson are a little bit further behind, so I haven't quite heard when they're going to be out, but they are working on it.
Another question that we have is in terms of kind of mixing and matching. So if your first dose is Pfizer, does it matter if your second dose is Pfizer or Moderna?
Yes. The initial doses of the Pfizer and the Moderna must be within the same family. So if I got a Pfizer for the first one, I need to get a Pfizer for the second. And the Moderna is the same way. After that, for the boosters, that's when they say you can mix and match. So if you got a Pfizer and you want a booster of Moderna, you can. Johnson and Johnson. They actually kind of semi-recommend that if you got a Johnson and Johnson, you should go with a Pfizer or Moderna at this time. So yes, you can mix and match. So where you can get the vaccines, most pharmacy, chain grocery stores, CVS, Walgreens, Stop and Shop, Big Y, even our Holyoke Health Center. We offer the vaccine Monday through Friday. We do it between the hours of 9 and 4. You can schedule appointments. You can walk in. Pharmacies and grocery stores, pretty much the same way. They would encourage you to get an appointment. If for some reason you can't do it that way, it's okay to go to vaxfinders.mass.gov and maybe they can help you find a place for it. So what you need to know about the COVID vaccines, they're effective at preventing COVID-19. They're definitely an important tool to help stop the COVID-19 pandemic. And it's a tool to help protect adults and children ages 5 and older from getting sick or severely ill. And it's a protection for all of those around you.
Mary Jo, could you tell us a little bit more about what you mean by protection for those around you?
So if I've gotten the vaccine or whoever gets the vaccine, it's obviously protecting me and helping me from getting getting COVID. So it's also protecting your grandmother, your aunt, your cousin, your friend, or whoever, because you're protected. And that's what we mean by the protection around you. It's helping those around you not get the COVID because you're protected. You've gotten the vaccine. So the vaccine, how it works in your body, COVID-19 vaccines help our bodies develop immunity to the virus that causes COVID-19 without us having to get the illness. Our bodies fight the illness when germs such as the virus that causes COVID-19 invade our bodies, they attack and multiply. This invasion is called an infection. It's what causes illness. Blood contains red cells, which carry oxygen to the tissues and organs, and white or immune cells, which fight the infection. The infection can take several days or weeks for their body to make and use all the germ-fighting tools needed to get over the infection. After the infection, the person's immune system remembers what it learned about how to protect the body against that disease. The body keeps a few T lymphocytes, white cells, called memory cells, that get into action quickly if the body encounters the same virus again. When the familiar antigens are detected, B lymphocytes, which are other white cells, produce antibodies to attack them.
So Mary Jo, if the body can remember, why is it that we need a booster?
Because some of our bodies don't always work as well as everybody else's bodies. That's one of the other reasons. The older population, definitely our bodies don't gear up and react as well as they used to when they were younger. Also, a lot of people who may have some other things, they could have an autoimmune disease, they could have respiratory issues, they could have some comorbidities that cause them not to have their immune systems work well. The other thing we have to remember too is just like with the flu vaccine, you know, you get that every year. This is kind of like along that same guidelines. It's just to remind our body, oh yeah, I remember this. I can fight this. And that's your way of protecting yourself and others. The vaccine, why people should get the vaccine if vaccinated people are still getting diagnosed with COVID-19. For all adults ages 18 and older, unvaccinated people were more likely to be hospitalized in critical condition due to COVID-19. And although weekly rates can vary, hospitalization in unvaccinated adults ages 18 to 14 was about 14 times higher than fully vaccinated adults ages 18 to 49 years of age, which is quite a bit, quite a lot. We really want to make sure that you're not hospitalized. Getting the vaccine kind of prevents it. Usually what helps is you can just stay at home. And that's one of the things that you've got less symptoms. Sometimes people aren't even aware that they have it unless it felt a little funny or off. So it's really, that's one of the reasons why we want you to get the vaccine. And what happens if you think you have the virus or have been recently in contact with someone who's now testing positive? There's many factors to take into consideration, but be sure you get tested about 3 days after the contact. PCR tests like the Stop the Spread testing site at HCC is preferred over rapid test. If you are an HCC student, faculty, or staff member, email coronavirus corona report at hcc.ed and learn what you need to do regardless, quarantine and or isolate. The reason why we do 3 days after is usually it takes that amount of time for any for the virus to show up in your system. So if you were exposed to somebody on today, you would basically have to wait 3 to 4 days in order to see if you would have any symptoms. So that's one of the main reasons why we say wait 3 days after contact. But if you do suspect that you might have something, you're really concerned about it, it is important to quarantine.
Mary Jo, if you do a rapid test and you get a negative, should you go back and do a PCR test a couple days later?
If you're feeling symptoms, and if you did that rapid test, like I said, if you did it like the day after someone, you know, someone said, oh, I've got it, I have COVID, and then it's definitely a good, definitely a good idea. The rapid test only shows what's quickly right there. The PCR is a more in-depth test, and that's the one that really is the one that everybody usually prefers, and it will give you the more accurate results. So yes, you should do that, especially if you're experiencing symptoms. So COVID-19 and race and ethnicity in the United States. Hispanic people represent a larger share of cases relative to their share of the total population. So they're about 70% of our population, but 27% of these of Hispanic people are getting COVID, which is, it's 10% higher. It is a difference. AIAN and Native Hawaiian and other Pacific Islander people, they make up similar shares of cases and death relative to their shares of the population. Black people make up a similar share of cases relative to their share of the population, 12%, but account for a slightly higher share of deaths compared to their population share, which is 14% versus 12%. Asian people make up a lower share of cases and death compared to their population. They share about 3% and 4% respectively versus 6%. I think what we have to look at with all of these things is a lot of these people are working in very essential jobs. They're so important to our economy and our society. These are the people who work in healthcare. These are the people who are helping caring for everybody. So that could be one of the reasons why their rates are higher, is because they're doing such a wonderful, active, great job being exposed, unfortunately, sometimes to COVID a little more than other people. What you need to know about the COVID-19 vaccines. The COVID-19 vaccines used here in the United States are safe and effective. The side effects are normal and generally only last between 12 to 48 hours. It can be soreness at the injection site. It can be fatigue. It can be headache. It can be a mild fever, mild flu-like symptoms. And once you get the vaccine, it takes 2 weeks, and then you are fully vaccinated for the body to build protection immunity. Keep wearing a mask and social distancing until you're fully vaccinated. And once you're fully vaccinated, you can resume many activities that you didn't before the pandemic, but you should wear a mask indoors and in the public, especially in areas of high transmission.
Mary Jo, could you give an example of what area of high transmission means?
Yeah, school. Schools are
Okay.
definitely an area of high transmission, because you do have a lot of, if you have in school, everybody's there all the time. You can think of going to a concert that you are, even depending upon certain restaurants can be very, very crowded. Hospitals, health centers would be a high transmission area. Riding a bus, if you ride a bus and it's crowded, an airplane, a train, any sense of public transportation can be areas of high transmission. So that's why we always encourage you to wear a mask. So some of the side effects of COVID vaccines, that, as we said, they teach our immune system how to recognize and fight the virus that causes COVID-19. Sometimes this process can cause symptoms, again, such as a fever. These symptoms are normal signs that the body is building protection against the virus that causes COVID-19. So when you get your vaccine, we always tell you, these are the things that you might get. One of the things that we also tell people is, don't pre-treat with a Tylenol and don't pre-treat with Motrin. Treat the symptoms if they occur. If you get soreness at the injection site, a good idea is to put a cold compress on it and just do it like that, and that should be okay. But if you get a fever, go ahead and treat it with Motrin. Go ahead and treat it with Tylenol, whichever one you prefer or you can take and tolerate. But again, it's not a good idea to pre-treat the symptoms. And if you have a severe allergic reaction to one dose, consult your doctor immediately. If you've been instructed not to get one type of COVID-19 vaccine, you may still be able to get another type. And if you have a known allergy to a vaccine, consult your doctor prior to your first dose. So if I was going to go for Pfizer or Moderna and I had a severe allergic reaction to that, they may say, try the Johnson & Johnson. That's something that you definitely need to make sure that you discuss with your primary care physician before you get your first dose of the vaccine.
And Mary Jo, what does a severe allergic reaction look like compared to, say, the normal kinds of reactions?
Respiratory distress is definitely one. If you get hives, a lot, all over body hives, that's definitely a reaction that you want to talk to somebody about. If, like I said, if you just get a little soreness, a little redness at the site, you're okay. You're definitely okay. But any respiratory issues, heart palpitations, severe heart palpitations, anything along those things, that's something that you want to make sure that you talk with your primary care physician about. So let's talk what's not in the vaccine. The vaccine ingredients vary by manufacturer, but none of the vaccines contains eggs, gelatin, latex, or preservatives, nor do they contain iron or nickel or cobalt or lithium and rare earth alloys. Manufactured products such as microelectronics, electrodes, carbon nanotubes, nanowire, or semiconductors. So they have no microchips in them.
Mary Jo, what about the story that was kind of made a lot of headlines about magnetic pieces?
Yeah. So it's kind of like that Thanksgiving trick that the little kids do at the Thanksgiving table, where they put the spoon on their nose because yes, it's a little wet and sweaty, and I've been hot, and it can stick there. No, it doesn't happen. It doesn't have any magnets in it, so you do not become magnetized. So some of the myth busters. Do COVID-19 vaccines contain microchips? No, COVID-19 vaccines do not contain microchips. Vaccines are developed to fight against disease and are not administered to track your movements. And can COVID-19 vaccines cause variants? No, the COVID-19 vaccines do not create or cause a variant of the virus that causes COVID-19. New variants of the virus just happen because the virus that causes the COVID-19 constantly changes through a natural ongoing process of mutation, which means change. They're looking ahead. Variants are expected to continue to emerge as the virus continues to change. We also have to remember that the COVID vaccine, it's not a live virus. So that's the number one reason why it can't cause the COVID-19. Am I getting the virus in my vaccine shot? No. The mRNA vaccines, they don't contain any live virus. Instead, they work by teaching ourselves to make a harmless piece of a spike protein, which is found on the surface of the virus that causes the COVID-19. And when an immune response begins, the antibodies are produced, creating the same response that happens in a natural infection. Can a COVID-19 vaccine make me sick with COVID-19? No. None of the authorized COVID-19 vaccines in the United States contain the live virus that causes the COVID-19. This means that a COVID-19 vaccine cannot make you sick with a COVID-19. You will experience some flu-like symptoms maybe with some people. Again, the soreness, the maybe a little tired, a headache, but that is not COVID-19.
Mary Jo, what about people who've caught COVID-19 more than once?
That's again probably more than because their immune system is not strong. The first time around, it could have been more severe, and the second time around, it's less severe. And it just, again, it's our body's immune systems. They don't work like everybody's immune system doesn't work the same. And this is one of the reasons why, again, we say the vaccine is helpful and beneficial, because it prevents severe illness, hospitalization, and death at times. So that's one of the reasons why we say get the vaccines. Is it true that it would be morally wrong for me to get vaccinated against COVID-19 because I'm Catholic? No, no, no. The Vatican's Doctrines Office, the Congregation for the Doctrine of the Faith, CDF, has determined that it is morally acceptable for the Catholics to take these vaccines against the COVID-19 virus. Their determination is deeply rooted in the Catholic moral tradition. Are COVID-19 vaccines safe even though developed rapidly? Yes. While COVID-19 vaccines would develop rapidly, all steps were taken to make sure that they are safe and effective. But we also have to remember, like I said before, we've kind of seen the coronavirus, the SARS, that's part of what the coronavirus COVID-19 is now. They've had a lot of these ingredients in place beforehand. Nowadays, we have so much technology and so many scientists were working on getting a vaccine out there. We were very fortunate to let them develop this as quickly and as safely and as they could at this point in time. Were fetal cells used in the development of the vaccine? Is there fetal tissue in the shot I received? No, and no. The United States Conference of the Catholic Bishops in a January document about the COVID-19 vaccine noted neither Pfizer nor Moderna used an abortion-derived cell line in the development or production of the vaccine. However, such a cell line was used to test the efficacy of both the vaccines, but they're not in the vaccine at all. So women in the vaccine, what are the facts about the breastfeeding and pregnancy related to the vaccine? Pregnant people are more likely to get severely ill with COVID-19 compared with the non-pregnant people. Getting a COVID-19 vaccine, it can help protect you from severe illness from the COVID-19. COVID-19 vaccinations are recommended for people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. Pregnant people can receive the COVID-19 vaccine booster shot as well. Evidence about safety and effectiveness of the COVID-19 vaccine during pregnancy, it's been growing. These data suggest that the benefits of receiving a COVID-19 vaccine outweigh any known or potential risks of vaccine during pregnancy. It's also protecting your baby. It's making sure that your baby doesn't get COVID. So that's a good thing that moms have to think about when they're pregnant. And if you want to become pregnant, will the vaccine harm me or my partner? No. COVID-19 vaccination is recommended for people who are trying to get pregnant now or might become pregnant in the future, as well as their partners. There's currently no evidence that any vaccines, including the COVID-19 vaccines, can cause fertility problems, which are problems trying to get pregnant in women or in men.
And Mary Jo, you said about the baby. So that if you are pregnant and you get the COVID-19 vaccine, would that harm the baby because it's so young?
No, it's going to protect the baby and it's going to protect you. There has been some things saying that babies get very small percentage, folks, but if the mom gets COVID and they're near their due date, and some of these babies are coming out with COVID, and you don't want that to happen. So it's important that you get the vaccine. And if you get the first dose, you can get pregnant after receiving your first shot of COVID-19 vaccine that requires 2 doses with the Pfizer or the Moderna. You should get your second shot as well to keep on with the protection.
Okay, thank you very much. Now we're going to go to questions. If anybody has any questions, please put them in the chat. In the meantime, Mary Jo, one of the things that we've heard about is people just being concerned about long-term effects of the vaccines. Could you talk about that a little bit?
So one of the things that we're finding, as everybody hopefully knows, that the vaccine has been around for, the first vaccines were given in December of last year. So we basically had a year of these. We've all gotten, a lot of us have gotten 2 doses of vaccines and 1 of Johnson & Johnson. We're now in the process of getting a booster. The effects are lasting. Even now, you're protected. There is some waning down of some protection over a certain period of time for some people. That's one of the reasons why they're recommending the booster. I'm assuming, and I'm not sure, but this might be something that some of us in the healthcare have talked about being something like the flu vaccine, where this might be something that we're all going to get every year, just like we get the flu vaccine, that it will last for that amount of time. But it is protecting against the Delta variants, which is extremely, has been in this country and it did a good job here of getting a lot of people sick. We don't want that to continue to happen. So it's important to continue with the vaccines.
And Mary Jo, could you talk a little bit about the Omicron? I'm not sure if I'm pronouncing that correctly.
The Omicron, so this is the newest variant that just, as we all, I don't know if any of you have heard, did just hit America. It came into California from someone who flew in from South Africa around the beginning of November. This is very contagious from what we understand. There's still not a whole bunch of significant knowledge in regards to whether or not the vaccines that we have are going to be able to prevent us from getting this one, but the scuttlebutt seems to be that it may be. From what we also understand is the symptoms are not as severe as others, but it's still fairly new to us and scientists, so we're all kind of in a waiting to see. The one thing I can tell you though is extremely contagious. So again, I'm going to stress, if you're in areas of high transmission, as we had discussed before, schools, hospitals, buses, et cetera, it's really important that you wear a mask and you protect yourself, as well as continue, if you have not gotten the vaccine, continue to seriously think about how important it is to get your vaccines.
Mary Jo, if I'm washing my hands, social distancing, and wearing a mask, why should I get a vaccine? Am I not protecting myself?
You are, but I think we have to remember that sometimes we're not 100% at doing all of those things. And also, I think we have to remember that we're all kind of back to socializing. We're all kind of having small gatherings, or we're going to certain things where not everybody is wearing a mask, not everybody is protecting, and it is those little slips that occur that can make it so that's what it just needs a little slip for some people to get the COVID-19. We don't always know. Some people have COVID and they're not aware of it. They're asymptomatic, so they're not showing any symptoms whatsoever, and they could be socializing with you without wearing a mask and you don't know it. So you could get COVID.
So I've heard that people who are vaccinated are less likely to be hospitalized for COVID-19. However, it seems that there's a lot of people who are vaccinated that still get COVID-19.
They do, but it's usually, as I said, it's usually a milder case. They're not getting hospitalized, and they're not dying. And I think that that's something that we have to look at. I think everybody nowadays, there's usually something somewhere about saying, oh, family members had this, and one family member got vaccinated and the other family member didn't. And you can see what happens with some of these families. The ones who are vaccinated are okay. The ones who weren't vaccinated, they end up in the hospital. They end up on ventilators. They end up, quite ill. And some unfortunately don't recover. So that's, again, another reason why we all need to get vaccinated.
Okay. Well, thank you very much, Mary Jo.
You're very welcome. It was my pleasure.
Don't see any more questions here. We want to thank everyone for participating. And again, if you have questions, the Holyoke Health Center is available to you. Also, if you go to cdc.gov, there is a tremendous amount of information available to you there. And of course, if you're looking to get the vaccine, vaxfinder.mass.gov, and you can make yourself an appointment, find out which vaccines are available and where. So thank you all very much.
Thank you.